Hi everyone, I'm Dr. Domingo and welcome to my first vlog at our new location. So a while ago I asked you, our followers, to suggest some topics that you would like me to talk about, and I would like to thank Shanae Lawrence for suggesting that I do a talk on diabetes. So diabetes is very common, we see it all the time, we hear about it all the time, and we unfortunately assume that everyone knows about diabetes and how it works, but that's not really the case. So thank you, Shanae, for suggesting this. So I'm going to talk quickly about type 2 diabetes. So type 2 diabetes is a chronic disease with persistently high blood sugar levels. And when we normally eat, this is what happens. So the pancreas gets signaled that there's sugar in the bloodstream, and it secretes insulin, which then helps the body to absorb that insulin out of the bloodstream and utilize it as energy. So when you follow an unhealthy diet and your blood sugar levels are persistently high, the pancreas has to secrete more insulin to facilitate that sugar out of the bloodstream and into the body. So after a while, with an unhealthy diet, the pancreas gets tired of having to secrete higher and higher doses of insulin, and it stops working as effectively. So what are things that put us at risk of developing type 2 diabetes? So being overweight definitely puts you at risk. Gaining weight very quickly over a short period of time puts you at risk. And then a family history. That's why when you go to the doctor, you'll see we will ask you, do your parents have diabetes or any other conditions? And then lack of exercise, very important. Age also puts you at risk, and then illnesses like polycystic ovarian syndrome, where there's imbalances of the hormones and weight gain and all of that. So when the pancreas starts secreting less insulin and it sort of gets tired, that's when the blood sugar levels go up in the blood, and that's when you start having symptoms. So this is a process that can take quite some time, and that's why often in the beginning you won't know that you're actually diabetic, and that's why it's so important to be checked every year. So what are symptoms of diabetes, of type 2 diabetes? So symptoms are excessive thirst, passing urine frequently, feeling excessively hungry, feeling very tired, having blurred vision. You might notice that you have slow healing sores. You might notice that you are having frequent infections, and then also unintended weight loss. So these symptoms are also very non-specific. They can also be ascribed to other things, so that is why it's quite tricky, and it's always better to consult with your GP. So how do we diagnose diabetes? So there are 4 ways of doing it. One would be a random blood sugar, which is the normal finger prick that you get when you go to the doctor or to the clinic. Then there is also a fasting blood glucose, where you also do the finger prick, but this is after your doctor tells you to fast for a certain amount of time. That's the second way. The third way is by doing an oral glucose tolerance test. So that is when you go and you get given a sweet solution to drink, and your glucose gets monitored over a period of time. The fourth way of diagnosing it is by doing an HbA1c. So that is a test that gives us an average of what your blood sugar was like over the past 2 to 3 months. So it's very good, and it's also good to monitor diabetes. So a lot of people will try and eat well the day before they go and see the doctor, but you can't really cheat that test. So that's the good thing about it. So once you get diagnosed, you will get started on treatment. So the first line treatment for type 2 diabetes is oral tablets. So there's 2 agents that we treat with, and your doctor will tell you which ones you go on. If you're not following the proper diet and exercising and doing all of that along with your medication, it will be more difficult to control your sugars, and then after some time, if needed, you will have to be started on insulin as well. So along with starting medication when you get diagnosed, it's still important to eat healthy and to do your lifestyle changes, exercise, and all of that. So if you are diabetic, there is a very good website called diabetessa.org.za, because a lot of people always have questions about what they can eat, and all of those things, which are very specific. That website is very good. It educates you, and it also discusses things that you can eat. But the best way, if you still struggle with all of these sources on the internet, the best way I would suggest is to go and see a dietitian, because they can actually help you make a meal plan based on what you eat, and yeah, what you enjoy, and that way you don't have to start eating new things or anything like that. Your dietitian can help you with a meal plan that will suit you and your needs. So yeah, that is my quick talk on type 2 diabetes. Thank you for listening. Please share this with your friends and your family, and please feel free to suggest more topics to talk about.